So, Tom, one thing that I've noticed during our conversation today, and actually in previous conversations, is that you're really hard on yourself. Yeah.
I suppose, but it's easy to do that. Things
Yeah.
are not good right now, and I'm just, I don't even recognize myself anymore. I am not this person, this miserable, pathetic person.
Yeah, well, that's what I'm kind of talking about. Like, I feel like when you're sort of beating yourself up internally, it's not helping you. I think that's kind of contributing to you feeling bad. And so, one of the things that I think might be helpful is for us to come up with a couple things that you could read on a regular basis, things that would be like statements that would really remind yourself of all your strengths, just kind of loving and kind statements that you could say to yourself and read. It could be very helpful. Just encouraging, kind of cheerleading statements. So, what is something kind of kind and loving that you could say to yourself that would be encouraging?
Stop being such a loser.
Well, that would pump me right up. Yeah. A lot of times, the patient won't know what they can say to themselves. This requires some back and forth. Asking the patient what they would tell someone they love who was in a similar situation can be helpful. So, seriously, though, what could you say to yourself? Or what do you think you would say to your kids? Let's say one of your kids was going through what you're going through. What would you say to them just on a regular basis to remind them that they're strong enough, they're going to get through this, they've been through worse, it's okay, people love them? What would you say to one of your kids?
Tell them that they can get through this, that they are strong enough to get through this, and it will pass.
Okay, so you are strong enough to get through this, and this will pass. How does that sound to you?
Encouraging.
Okay. So the reason it's so important that we have you really actively reading these thoughts that we're creating is because of brain science and neurochemistry. So essentially, when you think a negative thought, it gets locked in. And the more negative thoughts you think, the easier it is for your brain to think more negative thoughts. The good news is you can rewire the brain. So when you think a positive thought, the positive thought creates a new neural pathway, and then it makes it easier to think more positive thoughts, and then you feel better as a result. With Tom, I decided that he would benefit from knowing why coping thoughts work in terms of neuroscience. You should tailor the language and content of the intervention to your patient's level of interest and background. And what I'd like for you to do is to do two things. I think it would be very helpful to put them up in different places, in different settings, meaning in your car, maybe at work, maybe on your mirror in your bathroom, somewhere at home where you could kind of see them on a daily basis so they can kind of start hitting your subconscious mind. But I also want you to sort of actively use them. So when you start feeling bad, when you start noticing you're feeling down, you start noticing that you're shutting down or that you're overeating, or you start beating yourself up internally with these thoughts, I want you to pull these cards out and actually read them. And we can make them for your wallet to actively read them to help you feel better. Okay? You want to try that?
Okay, I'll try it.
Okay.